Good afternoon, ladies and gentlemen. I invite you to the debate that we will be doing the motion. This House believes that the pre-Hippocratic medical tradition is equally significant and relevant to modern society, as is the post-Hippocratic medical tradition. As proposition speaker, I will be here defending the motion that stands in my name. I will give a speech, followed by the opposition speaker's speech, and then we will both give our rebuttal speeches to close out the debate. Okay, let's begin. So ladies and gentlemen, this House believes that the pre-Hippocratic medical tradition being equally significant to modern society as is post-Hippocratical medical tradition. We will be modeling this House as the contemporary medical society with precedence to the Canadian system, but it can be relevant to just about any international medical system based upon Hippocratic rational medicine. So what I'm going to do for you today is first present my main three constructive arguments, and I'm just going to flush out essentially what these arguments are throughout my speech. So the first argument is going to be that pre-Hippocratic medicine was actually more medically advanced than what people thought it to be. The second argument will be that pre-Hippocratic medicine placed importance on the role of spirituality in the healing process, and this importance in spirituality was actually largely undermined by the post-Hippocratical medical tradition. And finally, the third argument will be that the inherent harms of the post-Hippocratic medical philosophy can be remedied by incorporating pre-Hippocratic medical traditions. So let's get into the first constructive argument. So the problem with understanding the pre-Hippocratical medical tradition that was in place is that there's just a lack of recorded evidence. So what we do know primarily comes from our reading and interpreting of sacred ancient texts, such as Homeric texts like the Iliad or the Odyssey, or from archaeological excavations of ancient Greek sites. So from these two methods, we can understand that actually perhaps the medical system that was there in place is more advanced than what we give them credit for, or what we think was actually there. For example, Homer demonstrates throughout his text, specifically the Iliad and the Odyssey, that he actually had a fairly in-depth and descriptive detailed understanding of human anatomy. And actually many experts believe that this extensive anatomical knowledge is best depicted through his description of wounds. So for example, in the Iliad, he describes how wounds are treated, and that there's the removal of the weapon, followed by cleansing and binding of the injured part, and then usually a soothing ointment was applied afterwards. And we see that this method is actually very similar to modern-day first aid techniques. We also understand that through his poems that physical fitness and health were actually very important to ancient Greeks and ancient Greek society. And this is evident through the description of Thersites in the Iliad, as he is described as being the ugliest man in the Greek army, specifically for his physical weakness and physical deformities. Furthermore, we do see from excavations that public health structures in Bronze Age civilizations, specifically the Minoan kingdoms, that they were fairly well established, and in some ways they even surpassed those societies that were to follow. So for example, the Bronze Age Minoan palace had a system of drainage that was superior to even that of any ancient civilization at the time, and even superior to that of any medieval society that was to follow for several hundred years. So we also see through these texts that Homer's portrayal of medical practitioners and doctors outlines the extreme significance that the ancient Greeks placed on these individuals. And we see this in the Iliad when it's described that we can ill afford to lose a comrade so skilled at extracting arrows and healing wounds. One surgeon is worth several spearmen. So from this, he actually establishes a tradition that places significance and relevance on the furthering of medicine. And we see that this importance placed on doctors and ancient surgeons allows them to progress in their field. So going on to the second constructive argument. What I previously described as more of the physical aspects of the medical tradition in place, but I want to talk about how the medical philosophy of pre-Hippocratic tradition is something that should actually be considered very relevant today. So specifically in terms of spirituality in the healing process. Pre-Hippocratic medicine places importance on the role of spirituality, and this importance is largely undermined by the arrival of post-Hippocratic medicine. So the effectiveness and importance of spirituality throughout the healing process is something that is stressed upon by many physicians in the modern era. So Larry Dossey, an MD, writes that the primary reason to focus on the role of prayer in healing is not to prove its effectiveness. And this is because addressing spiritual issues and beliefs can make a very big difference in the individual's perception and experience of the illness. And often this affects the health outcomes of the treatments that they're receiving at the time as well. So in this way, weaving spirituality into medical education has become a priority amongst leaders in the medical field. This kind of focus on spirituality and healing is especially important for palliative patients, or those that are undergoing treatment for a disease that has a very low chance of survival, or possibly even one that has no cure. So for example, terminal cancer. So we see that for these patients and the doctors as well, there is this inherent burden of fighting against something that is really an unwinnable battle. And in these situations, being able to give meaning to the life and to give meaning to the situation and sort of give a higher purpose for what they're going through allows the individual to come to terms with their condition and better accept the fate of their illness. So Viktor Frankl, who was a psychiatrist that wrote about his experiences in Nazi concentration camps, wrote that man is not destroyed by suffering. He is destroyed by suffering without meaning. So in this way, we believe that the pre-Hippocratic tradition and the philosophy actually allows for the importance and emergence of the spirituality in the healing process. And we believe that Hippocratic medicine and post-Hippocratic medical philosophy undermines this. We think that Hippocrates brought a very physical answer to what is a time-old philosophical question and philosophical struggle. And that almost that the entirety of the modern Western medical system being built upon the foundation of rational medicine, we see a decisive shift away from incorporating spirituality and divinity into healing. And we think that actually we see a stigmatization amongst the population. I'll take a POI.
Alright, so I recognize that there are benefits on your side, but what you haven't done for us today, Shivani, and what you need to do is justify that the prerogative of medical doctors should be inherently about spirituality rather than tangible scientific outcomes.
So I think that if these spirituality incorporations in the healing process actually have benefits to the patient and actually further their healing process and understanding their illness, then this does become the prerogative of all medical practitioners. If this is something that helps the healing process, it automatically becomes the prerogative of everyone in the medical field. So this goes into my next constructive argument, how we're going to talk about how pre-Hippocratic medicine, through honoring the god of medicine Apollo and his son Asclepius, what they were actually able to do is provide a medical philosophy that needs to be incorporated today. So the third constructive argument is that there are inherent harms in the post-Hippocratic medical philosophy, and this can be remedied by including pre-Hippocratic medical ideas. So there are clear problems with the medical system today, and this is evident when you see A, patients that are extremely unsatisfied by their medical process as a result of uncaring and unsympathetic doctors that walk out of treatment feeling as though they were a burden to both the system and the physician alike. And we also see this in terms of high rates of drug abuse, alcoholism, and suicide amongst physicians, rates that are actually one of the highest amongst any career path. So we think that if everyone obviously has to accept these harms that are present under the medical philosophy, we need to understand that this comes from the post-Hippocratic tradition of focusing on tangible benefits of healings. That is to say, the development specifically of cures and vaccines and etc. So we think that there is immense benefit in these outcomes. We're not going to deny that cures and vaccines are extremely useful to the medical prerogative, but we think that there's harm in focusing solely on these healing outcomes. And we think that in the current system, what we tend to do is focus only on these outcomes and in turn reject the healing process. So we see that the significance of the treatment process and its effect on the patient is actually better addressed and better respected by pre-Hippocratic medical traditions, specifically the Asclepian medical philosophy. So Asclepian medical philosophy focuses on facilitating the desire to heal, something that is largely forgotten in the post-Hippocratic tradition. So the pre-Hippocratic idea believes that patients are a psychosocial entity, and in this way treatment needs to address not just the physical ailments that they're experiencing, but also the psychosocial aspect of what the patient undergoes throughout the healing process. So we see the importance and the impact of the desire to heal in two specific ways that are relevant to the modern world. A, we see this in when doctors prescribe placebos, in that patients actually experience a physiological response even when a drug is not administered. So you see how mentality of a patient can actually affect the outcome of the physical treatment that is given to them, and can actually affect the healing outcome in the sense that if they perceive they are getting better, a lot of times that actually helps them get better in a more successful way. We also see this in patients that are turning to homeopathic, naturopaths, or herbalist medical practitioners, because we think that these alternate medical pathways actually do what post-Hippocratic tradition doesn't, and that they focus on the treatment process of the patient. They focus on the psychosocial aspect of what the patient is enduring during the treatment process. So we think that this is really significant in terms of chronic illness patients or people dealing, again, with terminal illnesses such as cancer, in the sense that tangible benefits from specific healing outcomes aren't as relevant to them as the actual healing process is. So we believe that in this way there needs to be a new medical philosophy in place, perhaps one that is capable of incorporating both the objective of healing from post-Hippocratic traditions, and also incorporating the objective of the healing process from pre-Hippocratic traditions. So, what have I told you today? I essentially outlined the three constructive arguments, being that 1, pre-Hippocratic medicine is actually more medically advanced than what we think it may have been. 2, that pre-Hippocratic medicine places a very necessary importance on spirituality that is largely lost in the post-Hippocratic tradition. And 3, that the inherent harms of the post-Hippocratic medical philosophy need to be remedied primarily by incorporating pre-Hippocratic medical traditions, specifically on the idea of focusing on facilitating a desire to heal and the psychosocial aspects. So for these reasons, we on Side Proposition are so proud to propose this motion.
Well, thank you, Shivani, for your speech. I'm going to kind of highlight first a little bit of refutation about Shivani's speech and about kind of the stance that Side Proposition has taken. So they focused kind of inherently on spirituality and how it should be equal to or more important than tangible scientific outcomes within the medical field. And we find this like extremely problematic on our side of the house. So first I'm going to do that refutation bit. So while spirituality may be helpful in the healing process, ultimately it does nothing or little to nothing in treatment, which is the most important aspect of medicine. Also, doctors are not pastors. While some physicians emphasize with their patients and promote the spirituality of their patients, they're not, you know, pastors, rabbis, or other spiritual leaders, and that's better left to those spiritual leaders. It's also inherently problematic to have physicians promoting a certain level of spirituality based on the fact that spirituality a lot of the time is based in irrational thinking, right? A lot of the things that Shivani has talked about pre-Homer were based on like a divine thought that when you were stricken with an illness, it was from the gods. And I'm going to go into that a little bit more in my constructive and why that's problematic. So letting physicians do this inherently changes the human behavior that physicians are supposed to have. So religious groups like Jehovah's Witnesses will reject life-saving treatment, and having physicians that will encourage that behavior is problematic and undermines medical treatment. So first into my constructive. So the immediate changes and outcomes of the Hippocratic method's approach to medicine. It completely changed the approach of medicine by introducing the natural origin of disease as opposed to the divine origin. So people before this method was in place honestly thought that when they were stricken with a disease, it was from the gods and that they should suffer for it because the gods had put it on them for some particular reason, right? And that suffering through it was like dignified. And we see that even today, and this is like our behavior that we don't want to continue because it's inherently irrational. From this aspect, he implemented reason and rationality when selecting treatments for his patients. His empirical nature allowed for a greater understanding of which treatments would be successful and should continue to be used, and which treatments were unsuccessful and should be rarely used. An example of this is how he restricted the use of bloodletting, which before him was used to treat almost everything. And despite being medically useless and actually extremely harmful, you know, physicians were using this continuously for anything from like a headache to like severe injury to like any part of your body. And it just seems like silly to go back to that. He focused also on preventative medicine, an idea which only became prominent after accepting the natural origin of disease concept, right? So beforehand, people just thought they were going to be healthy because the gods thought that they should be healthy. And then when they got ill, they thought, well, it's because the gods wanted me to be ill. So the Hippocratic method kind of denounces that and says like, no, you need to do these certain things and you will be healthy. And that's essential to kind of like our exceptional way of life that we have now, right? So that plays a huge role in that. He also implemented the importance of taking medical history as part of the treatment process. So beforehand, when patients came to what was, I guess, physicians, they were just treated for the wound or whatever the ailment they had come to without any past history. So he was quoted as saying, "Nobody can know medicine who is ignorant of what a man is. He who should treat patients properly must learn this." So the Hippocratic method taught that medical history should always be followed by a careful and complete clinical assessment, which is very key in preventative medicine that we have today. So my second piece of constructive here. So the revolutionary approach of rational medicine implemented the foundations upon which the modern medical tradition of progress is built. So his idea of the natural origin of disease caused him to implore other physicians to look for more natural treatment approaches, not just prayer, right? So before it was fundamentally prayer with what Shivani was talking about, like some small first aid type things, but then it was mainly praying and then hoping that the gods would redeem you. And he kind of deludes that and says that that's not the way to go. This effectively built the base upon which the dynamic nature of progress in modern medicine originates from. By accepting that disease does not just come from the gods, he allowed room for improvement in terms of medical treatment and diagnosis. This is very key to what we have today. So this rational approach and shift towards medical progress and not just stagnation that the Hippocratic method set up allowed for the development of incredibly significant medical contributions such as vaccines, antibiotics, and other huge medical treatments. Yes, Shivani.
Okay, but Dina, does this opposition not regret the dehumanization of the treatment process in exchange of the mechanization of treatment output?
I mean, and I recognize that there is a harm on our side that we're not valuing the spiritual element enough, but honestly, at the end of the day, I think that we have a comparative here of a world where people are healthy, and although not mentally comfortable all the time with their treatment or with their doctors, they come out alive, right? And on your side, we have people that might be encouraged to not accept medical treatment and then go to this divine nature. And we see that as inherently problematic. So although there are harms on our side, I don't think that is as big a harm that is on your side. So my last piece of constructive here. The Hippocratic Oath was one of the first formal guidelines in terms of ethics for physicians. It was an oath taken by physicians to protect all life, to hold in the highest regard one's teachers, to recognize one's limitations, and to renounce self-interest in the treatment of one's patients. So this is extremely important because this oath is actually still used today, right? And students still learn about it today, inherently making sure that we keep a standardization, right? This oath essentially brought forth a unifying code of conduct for all physicians to adhere to, and it thereby improved the standard of care given to patients. So this is largely relevant today to the point where as I said, many medical students are required to learn it to this day. And as my last point of constructive, that at the very, very least, other than all of these amazing medical triumphs, his revolutionary ideas immortalize the name of ancient Greece, thereby furthering the foundational legacy of ancient Greek philosophers and scholars. So what have I done for you today? I've talked to you about the immediate changes and outcomes of the Hippocratic approach to medicine and why those are inherently beneficial. I've told you about the revolutionary approach of rational medicine and how it was implemented and the foundation upon which modern medicine and tradition lies is within this Hippocratic method. And then third, I talked to you about the Hippocratic Oath and how it was the first form of standardization and continues to standardize the medical profession, and that this is inherently beneficial. So what we have today now is a side opposition has to prove to you that their comparative is better than the one that we currently have. So the status quo. Thank you.
Okay, I thank the opposition for their speech, and I'm going to begin my rebuttal, in which I'm just going to outline again the points brought by side proposition, and I'm going to tell you why our side of the house better answers the big question of why is spirituality, divinity, and this idea of focusing and facilitating the desire to heal as crucially and equally important to just the treatment outcomes and healing patients of their physical maladies. Okay, so just a quick summary of what I brought to you in the earlier speech. So I specifically talked about how pre-Hippocratic medicine was actually more medically advanced than people thought, and I gave you the examples of understanding it through Homeric texts and also through archaeological excavations of the Minoan civilizations. I also talked about how pre-Hippocratic medicine placed a necessary importance on the role of spirituality in the healing process, and how many physicians today actually recognize the importance of spirituality in their patients, specifically patients suffering from long-term illnesses, chronic illnesses, or those without a cure. And I talked about how the arrival of post-Hippocratic medicine has actually caused a negative shift in a sort of stigmatization that says that there is this mutually exclusive binary between spirituality, divinity, and healing. And then I talked to you about how the inherent harms of the post-Hippocratic medical philosophy present today needs to be addressed, and that they can be addressed by incorporating the philosophy of the pre-Hippocratic traditions. So now let's answer this big question. Why is what I'm talking about, how spirituality and divinity and this idea, why is this equally relevant? We think that, like, I brought this up when I answered Dina's POI earlier, in that if this is something that can actually, like, actively help the healing process for the patient, actually help the treatment process for the physician, it absolutely becomes a necessary prerogative for all aspects of every medical practitioner in the field. We think that this idea brings about this changing role of an actor, specifically that of the physician, and that they're not just vehicles of treatment anymore, but they're important in terms of, like, facilitating the progress of treatment. And they're really necessary in terms of things like palliative care. So for example, we see, like, oncologists, a lot of them already employ these philosophies because they understand the necessary requirement to facilitate the desire to heal, to allow for the spirituality to grow within the patient. And we think that this is something that can be better incorporated in all aspects of medicine. So we think that, like, for these reasons, this idea that, like, because this actually furthers the healing process, because this actually allows patients to walk out of treatment feeling more fulfilled by their medical system and their medical experience, by allowing patients that may not necessarily be cured to understand and to come to terms with their situation, we think that this is extremely significant and extremely relevant. Why is this important today? Because medical systems, medical institutions, and medical philosophy are something that every single person in this room, in this country that's watching this debate is going to come into contact with, whether it's in Canada or whether it's somewhere else in the world. How we set precedents in these institutions are going to affect how you experience life in the future, or how a loved one experiences life in the future. So we think that for these reasons that are brought to you by side proposition, this unique argumentation that cannot be denied by side opposition, we on our side of the house have won this debate for you today and proved to you why spirituality, why desire to heal is equally important as tangible health outcomes. Thank you.
Thank you, side opposition, for your rebuttal speech. So what I'm going to do for you today now is just kind of sum up the debate in one question, right? So the question of this debate is essentially what is best for the patients. So what world is better for patients? Survival and treatment. The world that is in proposition's name, that is inherently very spiritually based, or in opposition's name, which is inherently based on tangible scientific outcome. So what we believe is that we have proved to you today that inherently the status quo and what side opposition has defended is the better world for patients, and will primarily continue to be the better world for patients. So Shivani has presented to us again, while spirituality may be helpful in the healing process, I want to keep stressing this, that it ultimately does nothing or little to nothing in the treatment, which is the most important aspect of medicine. So what did I bring for you today? I talked to you about the immediate changes and outcomes of the Hippocratic approach to medicine. I talked to you about how we've moved away from the divine approach to disease because it was inherently problematic for the progress of medicine and treatment. I talked to you about the importance of taking medical history as part of the treatment process. I talked to you about how the revolutionary approach of the Hippocratic method created a lot of the modern medical traditions and progress that we have today. I also talked to you about how the Hippocratic Oath was one of the first formal guidelines in terms of ethics for physicians, and how this is still relevant today. But again, what it comes down to is a world where we have all of this inherent progress versus a world where we are valuing essentially just spirituality. And I've explained to you in several points why this would be inherently problematic. So the fact that Shivani has not actually tackled the point that I brought up about religion and Jehovah's Witnesses, and the fact that kind of encouraging religious behavior might be problematic for the treatment of individuals, makes her side fail today. And what she's also done for you today is only bring up that palliative care treatment will improve in this kind of world that she's presented for you today. The problem with that is people in palliative care are going to die anyway, right? So if we kind of take the spirituality element and put it into palliative care, we're not saying that that's a bad thing. We actually, on our side of the house, do regret that there isn't more spirituality within the hospital walls where dying patients are primarily a part of, right? But what we do regret on her side of the house is this inherent equality she places on spirituality versus tangible outcomes. I've proved to you today with all of my points that we've moved from spirituality for a reason. We've moved to scientific outcomes to save lives. So on my side of the house, you have people who are living good lives and have gotten proper treatment. And on Shivani's side of the house, you get people who die spiritually sound, but there are more people dying on that side of the house. So inherently my side has won today. Thank you.